This is a special report from News 3 WSIL.
Hello again, I'm Mark Kiesling. Tonight we continue our COVID conversations. The past few weeks we've been looking at COVID-19's impacts throughout our region and what it means for you. For tonight's conversation, we sent it over to my co-anchor, Julie Williams.
Yeah, thank you, Mark. We're joined tonight by Dr. Nate Oldham, the Chief Medical Officer of Ferrell Hospital. Now, Dr. Oldham, I want to thank you for being with us. And you are also a rural family health physician?
Yeah, rural family medicine. What you'll see in Southern Illinois is there are a few big hospitals, but there are a lot of small outlying hospitals. And so at those places, you have guys like me that kind of still do everything. We practice outpatient, inpatient, and sometimes ER as well.
Wow. Okay. So you're kind of seeing the whole, gamut of things. May I ask, what is it like right now at Ferrell Hospital, being a, rural community?
Yeah, so we're overwhelmed. I think that, in a lot of ways throughout this process, this past winter especially, we were kind of trying not to kind of tell the public how bad it was, just because we didn't want them to be scared to come to a hospital. If you have a need, if you're sick, we want to be there for you. We want to make sure you're there. But honestly, we're getting to the point now that it is overwhelming. We're seeing people in our ER that typically we would admit to the hospital, and we just can't put them in the hospital because there are other sick people that need those beds. And sick people with COVID especially, they take a long time to get better. So it's not just you're in the hospital for 2 or 3 days getting tuned up and you're home. These patients are in the hospital for a real length of time, critically ill. And unfortunately, people that would typically get admitted, we just can't admit right now.
And that brings up a great point, that these patients who are coming in with COVID-19, you say they're there for a long time. It's not just a day or two and you send them home.
No, unfortunately, especially the ones that have gotten bad, we all know about the effects that they can have on their lungs, that they have trouble breathing, their oxygen saturations drop. But the other effect that we don't talk about as much is the severe weakness that these patients have. You can get a patient that prior to having COVID is completely independent. And then after they get a COVID infection, they can't stand up. I mean, they literally cannot meet their needs at home. And so, yes, you're putting them in the hospital and you're doing those things to help them with the virus itself, to support them. But at the end of that, these patients often need rehab. They need several more days where they're going to be able to get up and go home and take care of themselves. These patients are often also going to need oxygen for several weeks after they've been in the hospital. They're not going home well. They're going home well enough that they can meet their needs at home, but they're still very sick in a lot of times.
Wow, very lengthy process. And, school is back in session, and we're seeing a lot of these COVID cases in school-age children. May I ask, as a family health physician, do you think it's coming to a point where we might need to pull kids out of school, or do you think, the mitigations in place are appropriate at this point?
I think schools are very important, and I think it's important for kids to be in school. Okay, there have been some school systems this winter that very successfully employed these strategies of mandatory masking, of social distances, of getting creative with how they seat students. They have a seating chart with changing lunches where maybe they, instead of having 2 lunches, they have 4 lunch periods. And they've successfully been able to navigate this and stay in school. It's important for our kids' education, yes, but remember the school system is important for other social functions. There are some kids, this is where they eat. I mean, they don't have meals if they don't come to school. This is where they feel loved, the only place in their life they feel loved. So it's important that we do what we can to keep kids in school. And I think if we are aggressive with following these strategies that are in place, they can work. It just takes school systems to get creative to do it.
Yeah, a lot of work into that. And, Pfizer right now is looking at, testing their vaccine in younger children. If it's approved, by the FDA, will you recommend it to your patients who are younger?
Yeah, so that's a long answer to, I know, a short question, okay? So most physicians, when you look at it, yes, we look at guidelines and we look at recommendations, and then we go and we say, okay, they recommended this, and then we go read the studies for ourselves, and we read the safety data, and we read how effective the vaccine is or whatever is being studied. I can say that I've done that with this vaccine with every age group that it's gotten approved in. And so far, for all of those age groups, I think it is very efficacious. It has limited side effects when you see that. I personally, and I treat a lot of patients, have not seen anyone that has had a severe side effect to the COVID vaccine, okay? So if the evidence is there, when that guideline comes out, then of course, I would have my patients get it.
Right. Great. Thank you. And this is actually a viewer question talking about, testing for COVID-19. There are some reports, whether they're factual or not, that the COVID-19 test can actually pick up the flu virus, and there are concerns that maybe that's, kind of inflating numbers. Can you speak to that at all?
So I don't know where this came from. I'm going to tell you, one of the fun things about my job is you get to talk to a lot of people, you get to hear a lot of things. Some of them are, well, they're things. And this test for COVID is very specific. What we are looking for is genetic material that is individual to the COVID virus. Okay. Influenza and COVID are uniquely distinct viruses. They do not contain the same genetic markers. They do not contain the same genetic material. A lot of people are coming and saying, and there's a conspiracy or something, thinking, well, no, this has just been a bad flu and we've renamed it. And the fact of the matter is that is blatantly not true. We didn't see a whole lot of flu last flu season because everyone is masking and social distancing, and flu is endemic. And so if we did that all the time, we would see very few people die of flu. But the fact of the matter is, these are two different viruses. There are no cross reactions between the tests with the viruses. If they tested positive for COVID, they had COVID, not influenza. Not
influenza. And there's a new, statewide mandate in Illinois that says healthcare workers must be vaccinated. At Ferrell Hospital, have you seen any kickback to that from your staff?
This is an issue that is very emotionally charged. Mm-hmm. I'll tell you that up front. And so I think the best way to this is to try to address this with information and data, mm-hmm. And truth. There is, with social media and the internet, there's access to a lot of things that are put on there that just are not true, and that is affecting people's opinion of this. Yes, we've seen some pushback, but I think at Ferrell anyway, as we get involved and try to educate people in a way that certainly is not making them feel silly or about the beliefs they have, but educating them about what the virus is doing, and more importantly, the vaccine. I do want to add this about the vaccine, because I don't think people realize how important it is to get this vaccine. Between 92 and 95% of all COVID hospitalizations are in unvaccinated people now. Wow. Less than 1% of COVID deaths are happening in vaccinated people. The way we're going to get on top of this is to prevent people from getting sick in the first place. And this vaccine is found to be safe and effective. And I think the more people hear that and hear doctors and nurses and providers that are passionate about this, that love them, they know they care about them, and they're telling them this. I've got kids, okay? My kids are vaccinated. I certainly wouldn't put anything into my kid's body if I thought it was going to hurt them, okay? This is safe. We're many, many months into this. We've given 380 million vaccines in this country alone, 4.5 billion worldwide. If there was a problem, this vaccine would not still be on the market. All
right. Well, Dr. Oldham, I want to thank you so much for joining us for tonight's COVID conversation. I really appreciate you being here. And we will have this entire interview on our website, as well as much more information on COVID-19. You can check that out at WSILTV.com.